Carpal Bones and Their Unique Features and Risks for Injury by Allison, Caitlin, and Maddie. To start, we thought we would share a little background about the carpal bones. There are 8 total carpal bones. The 8 bones include the scaphoid, lunate, triquetrum, pisiform, which form the proximal row, and then the trapezium, trapezoid, capitate, and hamate, which forms the distal row. There are mid-carpal joints between the proximal and distal rows, which allows for gliding motions. The bones collectively provide support and flexibility of the soft tissue of the wrist. The carpal bones connect the hand to the forearm. The carpal bones of the distal row attach to the metacarpals of the hand, and the proximal row attaches with the radius and the articular disc to form the wrist joint or the radial carpal joint. To remember the carpal bones, there are a lot of helpful mnemonics to use. For example, some helpful mnemonics are: Sam likes to push the toy car, she looks too pretty, try to catch her, Sally left the party to take Kathy home, and some lovers try positions that they cannot handle. The proximal row of the carpal bones are read first, lateral to medial, and then the distal row, lateral to medial. The first carpal bone we are going to take a deeper look at is the scaphoid bone. The scaphoid bone is located on the radial side of the proximal row and articulates with the radius, lunate, trapezoid, trapezium, and capitate. The scaphoid is one of the largest bones in the proximal row, and its name is derived from the Greek scaphos. Scaphos means bow, which is what the bone resembles. The bone is important for motion and stability of the radial carpal joint, which allows for flexion and extension, as well as abduction or radial deviation and adduction or ulnar deviation. The scaphoid bone forms the radial border of the carpal tunnel and serves as an attachment site. You can palpate this bone on yourself or others. On the palmar surface of the bone, there is a tubercle that can be palpated at the base and medial aspect of the thenar eminence when the hand is extended. It can also be palpated at the base of the anatomical snuff box. As mentioned in lecture, the scaphoid bone is the most commonly fractured carpal bone. It occurs from Fuchs with the wrist and radial deviation and can occur at both the proximal and distal part of the bone. As a result of injury, the anatomical snuff box does swell. The pain may be severe when you move your thumb or wrist or when you try to pinch or grasp something. Unless your wrist is deformed, it may not be obvious that your scaphoid bone is broken. With some fractures, the pain is not severe and may be mistaken for a wrist sprain. There is a risk for some avascular necrosis or death of the bone tissue due to the lack of blood supply, because a fracture to the middle and scaphoid bone may interrupt the bone supply to the proximal part of the bone. The next bone in the proximal row is the lunate bone. This bone is located between the scaphoid and the triquetrum. The lunate resembles a crescent moon, hence its name. The proximal surface of the bone is smooth and convex, which articulates with the radius. The lateral surface is flat and narrow, with a crescent-like facet articulating with the scaphoid. The medial surface is smooth, articulating with the triquetrum. Distally, the lunate articulates with the capitate and hamate. The lunate provides bony structure to the hand and wrist and provides stability to the radial carpal joint. The incidence of an isolated fracture and injury is low in regards to the lunate bone. The injury is low because it is enclosed in a lunate fossa. Injury typically involves a high-energy trauma to the wrist, such as a Fuchs. Most injuries of the lunate are associated with other wrist injuries. For example, the wrist could be an extreme dorsiflexion and ulnar deviation, and in turn would cause the radius and capitate to impart a large force onto the lunate bone, which would result in a fracture. The fracture of the lunate may also be associated with injury to the TFCC. Lastly, the lunate has a large cartilaginous supply around the bone out of all the carpal bones. This means there is less nerve supply, making it insensitive. There is also poor risk of healing and an avascular necrosis after injury, like the scaphoid bone. The triquetrum is a 3-sided pyramid-shaped carpal bone. It articulates with 3 other carpal bones, the pisiform, hamate, and lunate. The primary blood supply is from the ulnar artery. The primary function of the triquetrum is to shape and maintain the flexion of the wrist. Its name is derived from the Latin word triquetris, which means having 3 corners. The distal concave surface is meant for the hamate and is the largest of the articular facets. Common injuries with the triquetrum includes a triquetrum fracture, which is the 3rd most common of all carpal fractures. It is also common to fall and fracture in a sports injury, otherwise known as a Fuchs.
pisiform is the smallest carpal bone. It is pea-shaped. The name is actually derived from pisum, which is the Latin word for pea. It is one of the bones in the proximal carpal row. It is located on and articulates with the palmar side of the triquetral bone. The blood supply is from the ulnar artery, and the pisiform helps stabilize the wrist and allow mobility. It also protects the FCU tendon and supports the flexion of the wrist. It is situated on the outer side of the proximal row. It is bordered by the hamate bone on its inner side, and the pisiform can be felt on the palmar side of the wrist below the little finger. Some common injuries to the pisiform include tendinopathy, which is otherwise known as tendinitis, of the flexor carpi ulnaris. This can cause pain on or around the pisiform. The pisiform can also be injured with severe trauma in the wrist. It is also common to see a fracture in the pisiform due to fouche. The pisiform is very rarely injured or fractured. Pain and inflammation around the pisiform can also be due to wrist overuse and or misuse. The trapezium is an angular-shaped four-sided bone that resembles a trapezium, the geographic shape. The trapezium is the first and most lateral carpal bone. It is located at the base of the thumb and is the first bone in the distal carpal row. It is situated between the first metacarpal, or the lowest bone in the thumb, and the scaphoid with the trapezoid at its side. It articulates with two carpal bones and the first metacarpal bone. It is supplied by the radial artery. Due to the rich and constant blood supply, the trapezium rarely develops the avascular necrosis, which is death of a bone tissue, a condition common in some of the other carpal bones, occurring from inadequate blood circulation. The trapezium helps to shape the distal joint and maintain flexibility in your wrist. It also helps make up the trapeziometacarpal or carpal metacarpal joint, which is a saddle joint in the thumb, which is very vital for hand function. A saddle joint allows the thumb to move more than any of the other fingers and grasp objects. Some common injuries to the trapezium include a trapezium fracture, usually injured with other carpal bones due to trauma of wrist, such as a fouche. Other injuries include arthritis.
The trapezoid is a four-sided bone where the dorsal side is 2 times wider than the palmar side. It has a very stable position within the wrist, as it forms a relatively immobile joint within the second metacarpal base distally. In addition to this, the trapezoid is connected by very strong ligaments to the trapezium, capitate, and scaphoid bones, which helps to provide even more stability. It is very rare to see an injury to the trapezoid bone, and this accounts for less than 1% of all carpal fractures. This is due to the stable position in the wrist and connection to strong ligaments, as previously discussed. If a fracture were to occur, it would likely be for it to occur due to a strong bending or axial force applied to the second metacarpal base. The capitate bone is the largest of the 8 carpal bones, and as you can see in the picture, it is located in the center of the bones. Because of this central location, the center of rotation of the wrist passes through the capitate bone. Injury to this bone is very rare and only accounts for 1.3% of all carpal fractures. This is due to the fact that it is centrally located, so other bones protect the area around it. Also, it is a cuboidal shape, which provides strength, making it less prone to fracture. If a fracture were to occur here, there are 3 different postulates of the mechanisms for fractures of the capitate, which include direct trauma to the dorsal surface of the bone, fall on the palm with the wrist in forced extension, and fall on the forcefully flexed hand. Lastly, the hamate bone is a triangular wedge-shaped bone with 6 different surfaces. These surfaces articulate with 5 different bones. A unique feature of the hamate is the characteristic hook-shaped process, which is commonly referred to as the hook of hamate or the hamulus. This projects outwards from the lower part of the palm on the pinky finger side, and it has no bony articulations. Injuries to the hamate are uncommon, comprising only 2 to 4% of carpal fractures. These fractures are characterized into body or hook fractures, but hook fractures are much more common. It is rare to see combined body and hook fractures. Mechanisms for fractures include things such as blunt trauma, repetitive microtrauma, or FOOSH. Microtrauma is seen from gripping-related trauma that causes stress fractures. This is commonly seen in sports such as holding a baseball bat.
Just remember, some lovers try positions that they cannot handle.